A dental checkup probably isn't on the top of your summer to-do list, but putting off a routine appointment can actually end up costing you more in the long run, and we're not just talking money. Dr. Shedley Shatsky-Vincent from Aspen Dental is back with me today. Welcome to the show. It's always nice to have you here.
Thank you.
All right, so why do you think people avoid going to the dentist? Is it the drill? Does it have something to do with that?
It could be. I think there's a number of reasons. I think it's, anxiety,
Sure.
Fear of being at the dentist, and it could be a financial issue too.
All right, we're going to talk about gum disease today.
Yes.
Is that a big problem?
It is a big problem. The thing is that a lot of us have gum disease. They say the statistics are 75% of Americans have gum disease, and a lot of us don't even know it.
Wow.
So the thing is that you want to get to it early, because when it is just gum disease, it's reversible. But if it gets worse, it could affect the bone that surrounds your teeth, and you could lose the bone, and that's irreversible.
Are there warning signs, or is it just routine visits? How do we know?
There are warning signs: bleeding gums, swollen gums. Also, if you find when you're brushing your teeth or flossing or eating hard foods that your gum starts bleeding. Separation of the teeth or loosening of the teeth, or even if your partial dentures start fitting differently.
All right, so you're diagnosed with gum disease. Is there anything you can do at home?
Yes, there's regular maintenance that you can do at home. Of course, you want to brush twice a day with a fluoride toothpaste.
Okay.
You want to floss twice a day, and you want to maintain a well-balanced, healthy diet.
Now, what's the process once it's advanced? How do you take care of it?
Well, you want to keep up with your regular dental cleanings.
Okay.
There's gum treatments that you can do and gum therapy to get it stabilized.
All right, what can people do to maintain good oral health? We have a couple of suggestions here. First, you mentioned a fluoride toothpaste.
Yes, or fluoride toothpaste, yes, to fight the cavities. You want to brush, like I was saying, twice a day. You want to floss to keep the gums healthy.
Okay.
And to eat a healthy diet. And to keep up with your visits twice a year, regular checkups.
All right, let's go back to the toothpaste. What
Yeah.
about, you see whitening, fluoride? There's so many choices and varieties.
Yeah.
Can you recommend one, or what are we looking for?
I think any toothpaste that has fluoride in it is a good toothpaste.
Got it.
And there are other adjuncts too, that for teeth with sensitivity, you have like Sensodyne for sensitive teeth. Whitening toothpaste are good too. So.
All right, other than gum disease, what other big health concerns are we looking at?
You also want to be careful with oral cancer. That's something that could be life-threatening, and we do offer an oral cancer screening test. And what we do is we use a high-tech test where we use a glow stick that we put in your mouth, and with that we could see if there are any atypical cells that could lead to oral cancer. Because sometimes if you're just looking with your naked eye, you cannot see those atypical cells because they're so tiny.
Okay.
So with the glow stick, they're able to be more visible.
Got it. All right. For people that wear dentures, it's equally as important to go to the dentist twice a year,
Yes.
if not more?
Yes. It's equally important because, our mouth changes, our bone changes, and they recommend that we change our dentures every 5 to 7 years.
Okay.
So with those changes that we have in our mouth and with the bone, the dentures may not be fitting properly. And with that, you could end up with sores, you could have a hard time chewing, and that could also infect, the inner gastrointestinal parts too.
Okay.
So we want to make sure that we keep up with that so our dentures are fitting properly.
That goes all along with the overall health factor there.
Yeah.
All right, doctor, tell me about the special offer that you have for Connecticut-style viewers.
Well, we are offering 20% off dentistry and selected dentures, and for patients that don't have insurance, we offer free exam and x-rays.
All right, let's put some information up on the screen. If you'd like more info or to make an appointment, call 1-800-ASPEN-DENTAL or visit their website at aspendental.com. Dr. Vincent, thanks so much for being here, as always.
Thanks for having me.